Director of the Centers for Disease Control and Prevention Drive, Tom Frieden, announced Tuesday that a patient who recently arrived to the U.S. from Liberia had been diagnosed with the Ebola virus. It's here. The first case of Ebola has been diagnosed in the U.S. The Centers for Disease Control and Prevention has confirmed. An unidentified male patient in Texas who recently arrived from Liberia and West Africa is currently being treated for the deadly virus at a Dallas hospital, CDC Director Dr. Tom Frieden said. The patient began to show symptoms several days after flying into the U.S. on Sept. 20. He was therefore likely not infectious during air travel since the disease is not transmittable until symptoms are seen, he said. The male patient, who was hospitaled at Texas Health Presbyterian Hospital in Dallas on Tuesday, began to show symptoms of the virus several days after arriving in the U.S. on Sept. 20, Frieden said. Otero, AP. The male patient, who was hospitaled at Texas Health Presbyterian Hospital in Dallas on Tuesday, began to show symptoms of the virus several days after arriving in the U.S. on Sept. 20, Frieden said. There is zero risk of transmission on the flight, Frieden assured. Individuals may travel before having any symptoms. On or about Sept. 24, the patient began to develop symptoms and initially sought care 2 days later before being admitted to the Texas Health Presbyterian Hospital on Sept. 28. Once the diagnosis was confirmed, Frieden personally called President Obama and updated him on the hospital's safety protocols going forward. Map and dates of the male patient's trip from Liberia to Dallas. New York Daily News. Map and dates of the male patient's trip from Liberia to Dallas. The President and Director Frieden discussed the stringent isolation protocols under which the patient is being treated, as well as ongoing efforts to trace the patient's contacts to mitigate the risk of additional cases, the CDC said in a statement. Dr. Frieden noted that the CDC had been prepared for an Ebola case in the United States, and that we have the infrastructure in place to respond safely and effectively, it continued. The virus is only transmittable through direct contact with the blood or bodily fluids, including but not limited to urine, saliva, feces, vomit and semen of someone infected, or via objects contaminated with the virus, according to the CDC. It is not spread by air, water or generally through food. Dr. Edward Goodman, left head epidemiologist at Texas Health Presbyterian Hospital, Dallas, is seen Tuesday. He assured that the hospital has had a plan for handling Ebola in place for some time. Otero, AP. Dr. Edward Goodman, left head epidemiologist at Texas Health Presbyterian Hospital, Dallas, is seen Tuesday. He assured that the hospital has had a plan for handling Ebola in place for some time. Frieden dodged questions on whether the patient was a U.S. citizen, only saying that he was visiting family in Texas. Health officials are now working to locate others who may have come in physical contact with him while honing in on the patient's family and a couple of specific individuals in his community, Frieden said. If determined to be at risk, they will be isolated for 21 days to see if they develop a fever and other symptoms. Monday night, the Dallas Presbyterian Hospital publicly revealed in a release that it had admitted a patient into strict isolation based on the patient's symptoms and recent travel history. A person infected with the Ebola virus, shown, is not capable of infecting anyone else until they show symptoms, said the CDC. Fuse, Getty Images. Fuse. A person infected with the Ebola virus, shown, is not capable of infecting anyone else until they show symptoms, said the CDC. We have had a plan in place for some time in the event of a patient presenting with possible Ebola, said the hospital's head epidemiologist, Dr. Edward Goodman. Ironically enough, in the week before We had a meeting with all the stakeholders on the care of such a patient, and because of that we were well prepared to deal with this crisis. Dr. David Lakey, Commissioner of the Texas Department of State Health Services, said the state was certified August 22 to do Ebola testing. The bottom line here is that I have no doubt that we will control this case of Ebola so it does not spread widely in this country, said Frieden. Tuesday's shock diagnosis follows the treatment of 4 American aid workers at hospitals in Georgia and Nebraska after they contracted the virus overseas in parts of Africa. The National Institutes of Health in Maryland also recently admitted an American doctor exposed to the virus while volunteering in Sierra Leone. As of Sept. 23, there have been 6,574 cases and 3,091 deaths resulting from the virus that has no cure, according to the CDC's records. The 2014 outbreak is the largest in history and the first Ebola epidemic the world has ever known. Although the risk of an Ebola outbreak in the United States is very low, CDC and partners are taking precautions to prevent this from happening, the CDC says on its website.